Hi, I'm Dr. Anderson. Over the next few minutes, I will guide you through a brief tutorial on using NERV. The purpose of the NERV simulation is to allow you to practice performing cranial nerve examinations and to teach you to differentiate between normal and abnormal physical findings. During this tutorial, you will learn how to talk with the virtual patient, the behavioral capabilities of the simulated patient, and the tools available for conducting a physical examination. Periodically throughout this tutorial, I'll play the patient role to allow you to practice using the system. Communication in the NERV system functions similar to popular instant messenger applications. In the lower portion of your screen, you will see the conversation tool. To talk to the patient, click in the bottom portion of the text box currently highlighted in yellow. Type what you want to say, and then press Enter to send your message. Your message will appear in the upper portion of the communication box, now highlighted. When a patient understands what you have said, the patient will verbally or behaviorally respond to your question or instruction. A record of the patient's response will also appear in text format in the upper portion of the communication box. To see what this looks like, let's practice talking. Act as if I am your patient and ask me how I am feeling. I am doing well. Thanks for asking. To help increase the probability that your patient will understand your communications, I have a few tips to share with you. Write out all words. Messenger shorthand and abbreviations are not recognized. Use complete sentences. Be clear in distinguishing questions and information requests versus providing instructions. Specifically, if you want the patient to perform a behavior, phrase the request as an instruction. Communication should include a single concept. You'll be surprised how much your patient understands when you phrase your questions and instructions appropriately. Now let's address unrecognized communication messages. Specifically, when a patient is uncertain of the message you are trying to communicate, you will see a message in the conversation window indicating, "No response, try rephrasing the question." When this message is received the first time you communicate a message, check for spelling errors that may have prevented the patient from recognizing your message, or try rephrasing the question. If these options do not work, you may consider changing topics, as the NERV system is likely unable to recognize this specific communication content. So when you speak to the patient, you should expect either a spoken or behavioral response from the patient, or a message stating, "No response, try rephrasing the question." Now let's discuss the behavioral capabilities of the virtual patient. The virtual patients are able to perform a variety of behavioral actions involved in examining the cranial nerves. Using the conversation box, you can ask the patient to perform the following specific behaviors. In order for your patient to understand behavioral requests, it is important that you specify laterality when relevant. For example, you must specify if you want the patient to wink the right or left eye. Now let's practice asking the patient to wink. Click in the text box and type, "Wink your left eye." Great job! You should have seen the patient's left eye close and open following your request. Next, I will teach you how to use 3 virtual tools for conducting cranial nerve examinations. These include your eye chart, ophthalmoscope, and a virtual hand. You can activate these tools at any time by clicking on the corresponding tool icon located in the lower left-hand portion of your screen. The first tool we will try is the eye chart. To activate the eye chart tool, click on the eye chart icon in the lower left-hand portion of your screen. It is highlighted in yellow. Let's try this now. Okay, good. Now to use the eye chart to assess a patient's visual acuity, you can either ask the patient to read the lowest line he or she is able, or select a specific line for the patient to read by clicking on the eye chart and then pressing a key from 1 to 8. Let's practice this now. Click on the virtual eye chart and then select the 20/20 line by pressing the 7 key. Okay. Now ask the patient to read this line. PHUNTDZ. Now activate your virtual ophthalmoscope by clicking on its icon. The scope will now follow your mouse cursor. To move it closer or further away from the patient, hold down the right mouse button and drag the mouse up or down. Next, try turning on the ophthalmoscope light by pressing the L key. Good. Now approach the patient's face with the mouse until an image of the patient's fundus appears. Great job! You can drop the ophthalmoscope by clicking the left mouse button. This will let you freeze the position of an instrument and regain your mouse cursor. You will need to do this to move to the text box to ask the patient a question or to select another tool. Now drop the ophthalmoscope and we'll select the hand icon at the bottom of the screen. With this tool, you can do a variety of tests, including testing field of vision and extraocular movement. The movement of the hand is controlled like the ophthalmoscope. For now, we'll specifically practice performing a field of vision test. However, remember that you can use the same skills of controlling the hand and providing the patient with instructions to perform extraocular movement tests when examining your patients. You can change the number of fingers held up by the hand by pressing a key from 0 to 5. Try to hold up 2 fingers by pressing the 2 key. Great! That concludes the tutorial. Let's move on to your first patient. I know he's concerned about his condition and looking forward to talking with you.